Thank you, Dr. Cotton. Welcome, everyone. Today I'll be sharing with you about traditional Chinese medicine, focusing on acupuncture and how you can use it to improve your health. Let's start with a brief history. Acupuncture needles and divination bones have been found to date back to the Song Dynasty, which is around 1600 to 1043 BCE. The earliest written text, called Huangdi Neijing, the Yellow Emperor's Inner Classic, was written back in the Warring States period of 475 to 221 BCE. Emperor Wang was really smart. He wanted his subjects to be healthy to serve him. So he decided to send out his court doctors all over China to record, observe, and learn what the people were doing to help themselves. So that's how the medicine got started, through observation, regional data collection, and autopsies. Yes, even back then, they had autopsies. They didn't have microscopes to look at cells and viruses, but they were able to open up the body and see how the muscles are connected, how the bones formed, where the organs were, and that was invaluable information that helped them put this medicine together, which we call traditional Chinese medicine, or TCM. TCM has three modalities. Number one, acupuncture, which is what we know the best and what we're going to focus on. Two is Chinese herbal medicine. That's using plants, minerals, and animals as medicine for healing. And Qigong, which is movement therapy. Now, with acupuncture, what is it really? Acupuncture is an insertion of sterile needles into specific locations on the body to achieve what we call the qi, which is righteous qi. Now, qi is energy. Everything on earth has energy. And remember, this medicine was developed many centuries ago, and they had to come up with a word or a concept that described what they were observing and how everything works. So they came up with the word qi, loosely translated to energy as we know it today. And in modern science, teaches us that the movement of electronics creates energy, and that's how everything interacts in the universe. So little did they know that they were way ahead of their time. And what they were doing is that when needles are inserted into different parts of the body, each point has a function, and point combinations have functions. So a lot of these places where acupuncture needles are placed is where nerve bundles are closest to the surface of the body. Sometimes you may hear it as trigger points, or they're very close to trigger points. So as you can see, acupuncture needles can be placed on different parts of the body. We can attach a stimulator to the points during treatment, and also we can treat the ear, known as auricular acupuncture. And what about some of the tools that we use during treatment? The most common tool we know about is the needles, and that's what everybody always asks about. What are the needles? What do they really do? As you can see here, acupuncture needles is as fine as a human hair. They're very different than the blood collection needles that we already know, or the needles that we get injections from, right? They're not hollow. There's no medications on them. They're just sterile needles. Another tool we use is called guasa tool. Guasa literally means to scrape sand. A tool like this one is made out of jade. Some can be made out of water buffalo horn, or you can just use a spoon, anything with a slight edge. You scrape it on the skin and to break up fascia and to increase circulation to the area. Now, fascia is connective tissue that is found all over the body, in the muscles, around the muscles, on the organs, and it helps keep the body healthy and together. But when it's too tight, you can feel pain or even restricted movement. It's kind of like when you get a deep tissue massage, right? When they're working on you, afterwards, they release the fascia and you feel lighter and more relaxed and you have more movement. And that's what this is trying to do. Another tool we have is called cups, acupuncture cups. Initially, they were made out of bamboo. Now they're made out of glass or plastic. A vacuum is created so that it can suction onto the body. It can be stationary or moving, and it also uses to release fascia and to increase circulation to the area. And then another tool we use is called moxibustion. It's burning of the Artemisia plant. It can be placed on specific needles or on the body directly. That's to bring in warmth and movement to the area. Now, you hear me talk about circulation a couple of times. In TCM, there's a saying that goes, if there is pain, there is no free flow. If there is free flow, there is no pain. So what that means is when qi or circulation is impeded, we have disease, illness, and pain. When qi or circulation is unimpeded, then we have health. So really, circulation is the key to health, to good health. Now, how does it really work? When patients come and see me, they say, what is it? What is it that you're actually doing? Let's compare it to allopathic or Western medicine. Allopathic medicine is disease-centered. It has the same systematic protocol for everyone, and it's compartmentalized care. What do I mean when I say that? It means if you have a headache, you may be sent to a neurologist. If you have stomach pains, maybe a gastroenterologist. And if you have knee pain, you see an orthopedist, right? So the disease, the symptom becomes the focus of the care. But sometimes one system can be malfunctioning, but symptoms can manifest in a different area. What then? What do you do? Let's look at TCM. TCM is based on pattern diagnosis. I know that's a different term and it's very confusing, but so I'm just going to try to explain it the best I can. If 5 different patients come in with different symptoms, they may get the same treatment. If 5 different people come in with the same symptoms, they may get different treatments. What are you talking about? That doesn't even make sense, right? But in TCM pattern diagnosis, it makes a lot of sense. Different treatments for different root causes. It's a mind-body centered approach. So we're not chasing symptoms. We're looking at the root cause of a problem and focusing on that with physical, physiological, emotional, and psychological in mind. Okay, so a little example to help you clarify some of this concept is 2 real patients that I've had, and maybe this will help you. Patient number 1 complained of insomnia, fatigue, and headache. Patient number 2 complained of dizziness, tinnitus, that's ringing in the ears, and dry skin. Overall, both of these patients just complained that they felt not well. Why do I feel lousy? So they went to see their primary care physicians. Labs were done, blood was drawn, images were given, and everything looked normal. Everything was within normal range. They were also referred out to specialists, and again, tests were run, blood was drawn, and everything looked fine, but they felt lousy. So they decided to seek alternative care. Now, according to TCM pattern diagnosis, I gave both of these patients the same treatment. What did they have? According to TCM diagnosis, they both were diagnosed with blood deficiency. Now, that doesn't mean they were anemic. Remember, their lab results were normal. It just meant that the amount of blood in their body was insufficient for them. Okay, so everybody's an individual and everybody presents in a different way. And look at their symptoms. They both presented with different symptoms, even though they had the same problem. So once we started working on the root cause of the problem, all their symptoms disappeared and they felt a whole lot better. So with the mind-body approach and using the body's natural ability to heal, we can help the patients feel better. Now that you're all acupuncture students and doing very well, maybe you can help me diagnose this person. So when somebody comes in, usually the population that goes and sees doctors the most are between the ages 55 and 70. Okay, usually when you're younger, you're invincible, right? And when you're older, you've already been under care. So 55 to 70. Now, what if somebody comes in? Remember, you're acupuncture students, so you help me out. And they complain of night sweats and fever. What are we thinking between this age? Maybe hormone changes. They may be given out to an endocrinologist to test for hormones and see what's going on there. And what if they complain of weight changes? Oh man, I'm just getting old. I'm gaining weight. I've never had this problem before. Again, maybe it's a hormone change. Maybe an endocrinologist. Diet change, exercise routine change, some kind of change, right? Something needs to happen. What if they just complain of fatigue? I feel lousy. I've had a lot of people just tell me that. I feel lousy. Is it because I'm getting older? I hate getting older. So what can we do there, right? And what if they have something really significant like a persistent cough and not COVID positive? Maybe they'll go to a pulmonologist or another specialist. So now you see that they are chasing their symptoms. Now, if they have a lump, we all know that's time for an oncologist. But without the lump, what do all these patients, or what does this patient have? They may be dealing with cancer, and that's the root of the problem, and we need to start focusing on that. Now, how can acupuncture help? National Institute of Health Review have found the following benefits with acupuncture. It can help with anxiety and depression, digestive upsets, pain control, neuropathy, some sleep disturbances, palliative care with any chemo, radiation, and surgical intervention. With acupuncture, we can help minimize side effects. We can help maximize organ systems. When your organs are working correctly, not only will you feel better, but you can process the chemo and the drug therapies a lot better for your health system. And we can maximize healing, especially after surgery. And we can use acupuncture before, during, and after any oncology treatment plan. You don't have to wait until the very end to start feeling better. Now that you're ready, what does it look like to go and see an acupuncturist? What should you expect? I usually have my patients dress lightly, have a little snack or meal before a visit, discuss your medical history with your acupuncturist, physical and emotional. Remember, it's a whole body approach. And during the treatment, you want to feel the qi, remember the righteous qi, and relax. This is your time to heal. Make it your time. And how many times do you really have to go? It all depends. Acupuncture is cumulative. Acute concerns like a sprained ankle can typically take less visits than complicated internal conditions like cancer. Work with your practitioner and come up with a plan that works for both of you. Okay? Now that you're gung-ho and you're saying, I'm going to make an appointment tomorrow, how do you find an acupuncturist? Now, the next information only applies to Ohio. So if you're watching from a different state and you're going to share this with somebody who lives in a different state, you might want to check with the state licensing boards and see what it is for that state. Now, in Ohio, if somebody has an LAC after their name, they're called licensed acupuncturists. They have a minimum of a 3-year master's degree program learning about TCM and biomedicine. If they are LOM, they have a minimum of 4 years master's degree education program learning about TCM, biomedicine, and the difference is that they are also trained in herbology. They are certified through NCCAOM. On training, and they're self-certified through American Board of Medical Acupuncture. Physical therapists can also perform acupuncture in their practice. Again, nothing in the bylaws or address practice or education, and they self-certify after 3 to 7 days of training. Chiropractors must have 300 hours of acupuncture education. That's combining both clinical and in classroom. They can self-certify, they can practice dry needling. If they want to be licensed through the Ohio Medical Board, they must satisfy the NCCAOM requirements. And then last but not least, you may ask about insurance. Insurance policies are different for everybody. Please check your policy so that you know what yours provide. At UC, we offer acupuncture services Monday through Friday at the Barrett Cancer Center, the Westchester Hospital, and the Gardner Neuroscience Institute. Thank you for coming, and I will be available later for questions.